Okay. So good morning. I'm Eric Feldman, Associate Director of FIU in Washington, D.C., and I appreciate everyone joining us this morning. We're going to be hearing both FIU student and DC-based expert perspectives on what the new Biden-Harris administration should be focusing on in the areas of health, immigration, and technology, as well as from our expert panelists, how their organizations have been tracking and preparing for the transition to meet their own organizational goals. If this is your first time interacting with FIU in Washington, D.C., you can know that we are up here in the nation's capital representing the university through three pillars of operations. One is Solutions, which is our federal government advocacy and lobbying on behalf of FIU research priorities. The three topics that we are discussing today are included in those, as well as environment, Latin America policy, cybersecurity, workforce development, and various other things. We make sure that our South Florida delegation and other relevant committees in Congress know what FIU researchers are up to and are able to support those programs and have new legislation informed by our researchers' new knowledge. Idea Exchange is our line of programming that goes beyond just FIU students and South Florida members of Congress and invites speakers and panelists and discussants to events from all sorts of advocacy organizations, think tanks, and relevant agencies to position FIU as a leader of conversation in a variety of important issues. And last but not least, the part of the operation that I am most responsible for running and that this event is part of is our Talent Lab. The Talent Lab is everything that we do to support all FIU students and alumni who are looking to make an impact through DC careers and internships. A quick plug for some Talent Lab programming that is now available to apply for. We do 3-day policy seminars. There are 2 3-day policy seminars that are open for applications right now. Our Women in Politics and Policy Fly-In seminar, which will be taking place virtually. The applications for that are due Monday morning. And then our Future of Environmental Resilience Fly-In, which is a little bit later in the semester, so the applications are open a little bit longer. You can read about both of them at flyin.fiu.edu. I've put the link to that in the chat, and you can learn everything you need to know about when they're due, how to apply, and what those look like. The Environmental Resilience Fly-In is in April, so likely virtual, though with that one, we're gonna see how things go and maybe even bring folks up in person. We have 2 sets of guests that are featured in today's program. We have our 3 student winners of our over winter break essay policy contest. Natalia Liviero will be discussing her immigration policy essay. She's a doctoral student in our international relations program. Anais Menjivar will be discussing her health policy related essay. She is a political science international relations student. And I have to mention a Hamilton Scholar, which is our program that is also run out of the Talent Lab at FIU in DC. That runs every fall and spring for students looking to make a true policy impact through an internship. So I encourage undergrads on the call to check out the Hamilton Scholars program on our website. You can get to it from that same fly-in link, just navigate back over to the Talent Lab homepage. And also Laura Vega, political science student, who will be discussing her tech policy essay. Clearly our Stephen J. Green School of International and Public Affairs is strongly represented in the students who submitted and wrote great essays. So we are thankful for our partnership with our partners at SIPA. And our 2 DC-based experts, Laurence Benenson is the Assistant Vice President of Policy and Advocacy at the National Immigration Forum, and Jason Resendez is the Executive Director at the Center for Brain Health Equity, which is part of the UsAgainstAlzheimer's. And I'm so thankful for both of them being able to join the call today as well. So Laurence and Jason will be focusing on immigration and health, which are 2 of our topics of interest. So what about technology? If you are someone who's looking for some more expert takes on tech policy, I'll have to ask you to join us again the week after next, which happens to be Panther Alumni Week. I have 2 fantastic events scheduled for the first week of February, one focused on how the federal government regulates social media and other technology platforms, and another one on careers in space industry. And so I posted the links for each of those in the chat as well. And I hope to see some of you again at those events. Last but not least, I would love to see some of our student participants introduce themselves in the chat. Feel free to say what drew you to the topics of this event and why you're here today. If you are looking to intern or work in DC, we'd love to know that so we can all know who's in the room. How questions are going to work. You can ask a question in the chat at any time while our students or DC-based experts are speaking. Feel free to type a question in the chat. When there's an appropriate moment, I will see that you have a question because you chatted it, and I'll ask you to present that question over video so that our guests can hear it directly from you. That's how I'll know that you have a question. So without further ado, what I'd like to do is start with one of our first student presenters, and then we'll alternate between students and DC-based guests. I'll ask them to present something, and there'll be plenty of time for Q&A. I would really love for this to be driven by the questions that students have, and our student panelists are welcome to ask questions to our DC-based panelists as well, absolutely. But if I can ask Natalia to tell us a little bit about herself and a brief overview of what she wrote about and what policy she is suggesting in the area of immigration.
Yeah, sure. Good morning. Can you hear me well?
Absolutely.
Okay. So good morning, and thank you, Eric, and thank you everyone at FIU and DC for this opportunity to voice our concerns, our policies. As you can tell by my accent, I'm an immigrant, but that's not the reason why I chose to write on immigration. I was privileged to come to the States in 2002 with a work visa, and that led me to get my citizenship. I'm from Argentina. I have a bachelor's degree in international business. I work all my life in that field. I'm fluent in several languages, but really my passion is foreign affairs and diplomacy. So I took my master's in global governance at FIU in 2015, and in 2017, I decided to quit my job in Miami and go to volunteer to the Middle East. So I spent almost a year with a Catholic organization working between Jordan and Israel. In Jordan, I work with Iraqi refugees and Syrian refugees. And then after my mission, I went on vacation to the island of Roatan in Honduras to spend some time with my mom, who decided to retire there. And while I spent my time in Honduras, I got involved with a very poor community, and I learned a lot about the difficulties Honduras have and why they decided to come to the States. I decided to stay there, and I volunteer with the Catholic Church as the coordinator of the Pastoral of Human Mobility for the islands. So those experiences, being in Jordan and hearing the frustrations of the Iraqi refugees that they couldn't resettle in the US due to the travel ban, the protracted Syrian refugee crisis in Jordan with almost 1 million refugees there that cannot resettle overseas. And also in Honduras, listening to the migrants, the return migrants and the deported migrants from the US and Mexico and all the difficulties on the way. Now I feel that I have, this is become my passion to really voice their concerns and how we can help them. So this policy gave me the opportunity to put something together. And my proposal is basically to revert some of the controversial immigration policies by the Trump administration. And I'm glad to see that already Biden implemented some of them. So one is to stop the deportations during the pandemic. For the migrants that are already detained in the US, I propose to reallocate the budget from each flight with deported migrants and to shelter them here and providing them with adequate COVID-19 protection, such as PPE, social distancing, testing, and vaccination. Taking Honduras as an example, approximately 40,000 Hondurans were deported during 2020 since the pandemic, and already more than 800 Honduras have been deported during the first 2 weeks of this year. Second, to eliminate the MPP, which is the Migrant Protection Protocols implemented in 2019. Asylum seekers to the US should wait for their case to be heard in the US while living in decent conditions and receiving fair treatment instead of waiting in Mexico as per the protocols. The US could partner with migrant houses run by faith-based organizations to host those migrants, treating them with dignity. Third, increase the asylum seeker ceiling under the Refugee Act of 1980 to more reasonable levels. In 2016, under the Obama administration, it was 85,000. Trump carried it down to 50,000 in 2017 and down to 20,000 last year. Fourth, reverse the foreign aid cuts to Central America. Programs to address the domestic issues that foment irregular migration to the US are $27 million lower than the aid budgeted in 2020. the budget should be incremented and even more aid incorporated for the reconstruction of areas affected by hurricanes Eta and Iota in Nicaragua, Honduras, and Guatemala, and restore the aid suspended to the Northern Triangle, which is El Salvador, Guatemala, and Honduras. And 5, reverse the Trump administration's plan to eliminate the Inter-American Foundation in 2021. This agency was created as an independent U.S. foreign assistance agency through the Foreign Assistance Act of 1969 to foster economic and social development in poor communities, conducting smaller and more flexible programs that USAID cannot handle. So as of today, the active COVID-19 cases in Mexico and the Northern Triangle are still high. The US should resume its leadership role in the region by protecting Mexico and Central America from COVID-19 and helping them stop its spread by halting the deportations and by infusing economic aid in programs that will help eliminate or at least reduce the driving factors for migration, which are government corruption, gang violence, a poor education system, and lack of economic opportunities. Thank you.
Natalia, thank you. Laurence, I think since this is an introduction to FIU for you, what you're seeing in Natalia is something that is common among many of our students, which is a combination of a deep personal background and personal passion around a topical area and a competency in digging into and understanding kind of the policy nuance of things. And Natalia, that was fantastic. So Laurence, from your end, and I know you mentioned to me that your personal focus areas are on some specific, and I think even interior immigration policies. What's on your mind as we start a new presidential transition this week? What are the issues that you focus on, and how have you and your organization been tracking and preparing for this change?
Sure. Well, thanks for having me, and I'm really glad to be a part of this and hear from your students and Natalia. Really appreciated that. Just want to give you a little background on the National Immigration Forum. We've been around almost 40 years at this point. We were founded in 1982. We're pro-immigration and we support the values of immigration and immigrants generally to the US. We're a little bit unique in the DC immigration space in that we actually do a lot of work with pro-immigration constituencies that are located on the center right. And primarily that includes faith, business, and law enforcement constituencies. We've seen our immigration debate in this country go in a very dark place over the last 5 years or so. It's become very partisan, it's become very negative, and we're eager to see reversal of a number of those trends under this new administration. So we're hopeful that we can get to a better place in immigration policy. It's really important we move away from this issue as something which has been fostering partisan warfare and get back to a place where we can see bipartisan solutions occur. And get back to a place where, you had President Reagan pass a bipartisan immigration bill with Democrats and Republicans coming together. You had President Obama nearly pass a bill and get the Senate with Democrats and Republicans pass a comprehensive solution as recently as 2013, even though it didn't go anywhere in the House. So we're eager to get back to a place where we can get in a constructive conversation and move these issues forward. Our priorities for the Biden administration are actually set out on our website, immigrationforum.org. I can enter that in the chat box after. It's right on the front page. Encourage you all to look at what we've written on this, but I'll run through them quickly. A number of these issues are things that Natalia talked about as well. This is kind of laying out some general broad areas where we're focused. First, we think it's important that the new administration provide opportunities for earned legalization. We have upwards of 11 million people without status in the US. They're people who in most cases are contributing, have families, and can really help improve our nation. And we think it's really important that Congress and the new administration get together and find a solution to bring these people out of the shadows. And primarily if you're talking about dreamers, temporary protected status recipients, and essential workers who are helping us get through the pandemic, we want to see a legislative solution. And as a stopgap, things like DACA can also help and TPS, but we want to see a legislative solution to get these people in a situation where they can pay restitution, pay back taxes, pass a background check, of course, but get an opportunity for legalization, get in a line where they can eventually get right with the law. Another area we're focused on is expanding opportunities for legal immigration. Our visa system is very broken in this country. It's out of date, it's antiquated. Some visa categories haven't been updated since the 80s or early 90s. And we've seen a number of arbitrary roadblocks in the past administration make it difficult for people to get visas. And these are people who can contribute, where they're needed workers, and we have employers who desperately need the help even during the pandemic. And we wanna break through some of that red tape and update our system, bring it into the 21st century, and get these opportunities for legal immigration and for fixing our visa system. Third is an important one, which I'm sure everybody's following, but treating vulnerable migrants with compassion. Restoring our asylum and refugee systems, which have been degraded so much over the past 4 years, and have really been a departure from the US's traditional role as being a leader in this area, being a place where people can seek refuge. We've moved away from that, and we're hopeful the Biden administration can get us back on track in having a functional asylum system, and again, accepting refugees and getting back up to the numbers we saw under Democrats and Republicans, where we were accepting upwards of 100,000 or so in some years, refugees to help people get resettled and get the help they need. We also think it's essential we continue to focus on ending family separation and reuniting families that were separated who still have not been brought back together, and there are still hundreds of families that remain apart, and also improving detention conditions. And in the context of COVID-19, that's ever more important. We support effective border security at the National Immigration Forum. We're not for open borders. And we do think that border barriers can be a part of the solution, but they're not the only solution. And we want to move away from this conversation we've had the past 4 years, where the sole discussion has been on a border wall and all the spending has been on border barriers. And we want to find ways where we can effectively provide border security. And that includes using technology, implementing policies where personnel is deployed to places that make sense, and also making needed investment supports of entry. And finally, an area that I focus on a lot in my portfolio, but enforcing our immigration laws judiciously. Getting new enforcement priorities. Under the previous administration, all undocumented persons were a priority, and if everybody's a priority, no one's a priority. We want to see an enforcement priority system under this new administration that has threats to public safety and threats to national security as the highest priority for immigration enforcement, while maintaining people who have lived and worked consistent with the law for a number of years, having those be a lower priority for enforcement. That only makes sense. Same time, we have a 1.3 million case backlog in our immigration court system. It's largely ground to a halt. We've seen a totally dysfunctional asylum system. We want to fix that. We want to see our immigration courts work. We want people with valid claims getting in front of an immigration judge and making their claims and having their day in court. And we're hopeful the new administration can take steps to get us back in that direction. Because I don't have a lot of time, I'll just briefly say we're encouraged from what we've seen over the last couple of days. President Biden rolled out a broad framework for a legalization bill. We're hopeful that can be a starting point for a bipartisan conversation on a comprehensive immigration reform. President Biden also released a number of executive actions, everything from halting the travel ban that affects primarily majority Muslim countries, to strengthening DACA, to pausing deportations and overhauling our immigration enforcement system, and a number of other steps. And we know that President Biden's planning on issuing additional executive actions later this month. So we're hopeful that the fact that this seems to be a priority of this administration is going to allow significant progress to be made on these issues. And I'll just say, as an organization, the National Immigration Forum and our constituencies might not agree with everything the Biden administration does, but we're encouraged to this point. We're pleased to see that this administration is prioritizing these issues, and we're hopeful we can get back to a place where we have true bipartisan work on this and have Democrats and Republicans working together to improve our system and get it back to a functional place, and get back to having this issue be an area of bipartisan agreement as opposed to partisan warfare. So thanks so much for having me and letting me share that.
Thank you, Laurence. I did post the link to your website in the chat already, and I also posted a link to a Reuters article on Biden's proposal that he already sent to Congress. So I do encourage students to check those out and to get questions ready. That Laura has already posted a question that crosses these topics. These topics obviously do not exist in isolation, so we'll do Laura's question right after our health segment, but certainly look forward to questions that can be directed to both Laurence and Natalia about immigration. Our Hamilton scholar, Anais, can you share a little bit about yourself and your essay?
Sure. Good morning, everyone. It's a pleasure to be here with you all. My name is Anais Menjivar, and I'm currently a senior majoring in political science and international relations. I decided to write my essay on how the Biden administration should prioritize an equitable vaccine distribution policy, including creating a task force that is tailored to ethnic needs in different communities. And my entire life, I've always been invested in healthcare, even if it was indirectly. I grew up in a multilingual, multicultural community where I had ringside seat to witness how the issues of race and ethnicity, and oftentimes culture and language barriers, intersected with all aspects of society. And this drove not only my interest in healthcare, but also policymaking and how those elected to office can provide the change needed in communities like my own. My goal is to one day work for Congress, creating solutions for multicultural communities like my own, and to essentially make the world a more just place to live. And to get into like the nitty gritty of my essay and policy proposal, my policy proposal consists of providing an equitable vaccine distribution process for communities of color while finding a manner to control the spread of misinformation. COVID-19 has had a detrimental effect on individuals of color, with data showing minority communities experiencing much higher rates of infection and hospitalization rates. Black and Latino citizens were 4 to 9 times more likely to be infected by COVID-19, oftentimes also suffering from chronic conditions. And historically, minority communities have less access to healthcare, especially high quality healthcare. Issues such as mistrust, staff treatment, and language barriers make it extremely difficult to obtain high quality healthcare. And similarly, when it comes to effective public health messages, mistrust prevails due to historic racism and limited English proficiency, making health addresses difficult unless trusted community members provide the announcements. And specifically, physicians of color and other languages besides English would be very useful in providing messages to different communities. And many communities do not receive important information early as a result of language barriers and a lack of trust. And aside also from misinformation, physical structures of systemic inequalities help increase infection rates and deaths. And as the virus spread through aerosols, proximity increases risk increasingly. Those who live in densely populated areas or multi-generational households in small living spaces do not have the luxury of socially isolating themselves, cultivating an infection area. And essentially what this proves is that minorities are not more genetically susceptible to COVID-19, but instead social conditions are to blame. And with these characteristics in mind, I believe the Biden administration should take into consideration how access to healthcare will fundamentally affect individuals and how they can obtain vaccines. And once the vaccine is made readily available, the administration must create a plan on how to convince minority populations to receive the vaccine while combating the spread of misinformation. And to combat these obstacles and ensure equitable access to the vaccine with appropriate information made available, I believe there are some possible courses of action that should be taken into consideration. For one, informing the public that the vaccine is free and how populations can access it to reduce potential cost concerns, such as being uninsured or being an immigrant. And another manner of addressing health inequalities within the vaccine distribution process is setting aside an equitable amount of vaccines and prioritizing some groups for initial access. So in my research, I actually noted that the National Academies of Medicine, also known as NAM, frameworks that prioritizes allocation to areas identified as vulnerable through the CDC Social Vulnerability Index. And I also noted in my proposal that task forces on health equity should be incorporated into distribution plans. By doing so, the task force will be able to better address the needs of local ethnic groups by tailoring communication materials that are also linguistic and culturally appropriate. And the task force can also incorporate trusted messengers who have shared backgrounds and experiences with the people they are trying to reach to better communicate with diverse populations and improve public trust. Because at the end of the day, not everyone is going to want to receive the vaccine, but if you have a trusted person that you believe is providing information that not only pertains to you and your cultures, but is also scientifically and readily available, they're more likely to trust you in getting the vaccine. And although these are broad suggestions, I believe if executed correctly, they can lead to a more equitable healthcare system and provide a foundation for more change in the future.
Nice, thank you. That was fantastic. And I just pasted into the chat a link from the Miami Herald today about racial disparities in the South Florida vaccine distribution thus far that I saw today. Wanted to make sure to bring up after your talk. Jason, when I think of health equity, I think of Jason Resendez. Can you tell us the goal of the center that you've recently started leading and what's on your mind this inauguration week as it relates to those goals?
Sure. So first, thanks so much for having me. I'm excited to be among so many amazing young people. So I want to echo some of the things that Anais outlined. I mean, this idea of the importance of culturally tailoring and building for inclusion and equity is the name of the game. And that's where we are. I mean, we can't, that's not an option anymore. The pandemic has shown us the impact and the effects of business as usual when it comes to how we address health and public health in this country. And that's a perspective that Us Against Alzheimer's has had from the very beginning of our founding about 10 years ago. We launched the Center for Brain Health Equity with support from the Centers for Disease Control and Prevention to help increase public awareness about the impact of Alzheimer's and related dementias on the Latino and Black communities. Latinos are about 1.5 times more likely to develop Alzheimer's than non-Hispanic whites. Blacks are 2 to 3 times more likely to develop Alzheimer's than non-Hispanic whites. And like the coronavirus, this is a major public health crisis. You know, one of the things that I really appreciated that was said early on in the pandemic is that COVID is a crisis, a pandemic on top of many public health crises, and it exacerbates many of these crises. Alzheimer's is one of those. It's the #1 most costly disease in this country in terms of Medicare and Medicaid spending. It is a disease that has intergenerational effects, goes beyond just the individual living with the disease because of the role that caregiving plays in Alzheimer's. So Alzheimer's, many of you might have a personal connection. When I do in-person talks, I always ask, raise your hand if you know someone who's been touched by Alzheimer's, either a family member or a neighbor. And particularly when I'm speaking to groups of color, it's more than half of the people raise their hands. And I say, I'm never surprised, but always shocked by seeing that. And it's similar to what we see with COVID. I mean, the data that we're able to now look at across demographics really bears out a similar story. And so we're really focused on ensuring, one, that we're responding to COVID. In order to respond to Alzheimer's right now, we have to respond to the current pandemic. Particularly because, again, there's a lot of overlap between the coronavirus and Alzheimer's and related dementias in terms of people of color being at highest risk, but also in terms of the impacts on the older American community. And so for those reasons, we've been really focused on addressing COVID, and from a health equity perspective, we've been looking for those intersections and how to address this where it's benefiting both general public health, but also those individuals living with and touched by dementia. So 2 of those big issues have been data reporting. Early on, the Trump administration was really reluctant to do many things, but one of the things they were reluctant to do, including federal health partners, was to release disaggregated data on the impact of COVID across communities. So we were early in joining others to push for disaggregated data or data collection that's disaggregated, and then data reporting that's disaggregated, so that we know where and among who COVID was impacting. And it took some time, but eventually we started to get data. Some of it was from states who are better actors than their federal partners, but eventually we started seeing better data reporting across subgroups and data that was adjusted for age, so that we could see the true impacts of coronavirus on the communities that we're targeting. And Anais highlighted, the stark realities of that data. But that is really what the first line of defense is, knowing where and to the extent that any health issue is impacting communities, so that we can tailor our response. And that was the second thing that we were really focused on, was tailoring our response to high risk, highly impacted communities. Initially, we saw HHS not doing a great job in terms of how they were mobilizing minority serving institutions to respond to COVID. And so we mobilized with the Health Equity Collaborative, which is a coalition of organizations working to advance health equity, to really highlight the fact that HHS needed to do more through its Office of Minority Health and Health Disparities to address COVID from a culturally tailored way, and in a way that was recognizing the fact that if you have cognitive health issues, like individuals living with Alzheimer's, you're going to have to think about things like consent when it comes to testing and to vaccination. So how are those things being considered? So our tailored response and improved tailoring in health services and outreach was a second priority. And then last, really focused on, again, those caregivers of individuals living with Alzheimer's and dementia, who many times are working, particularly Black and Brown caregivers. Black and Brown caregivers are disproportionately impacted by dementia caregiving because we're least likely to be able to have outside support, least likely to be able to put our loved ones in an assisted living facility. Part of that is financial, part of that is cultural. So we had a lot of folks who were dealing with childcare, elder care, and workforce disruptions. Before the pandemic, a lot of folks would use things like adult day services, being able to take your abuela to a place where she was going to get support throughout the day and then come back home. Those adult day services were shuttered because of the coronavirus. And every COVID response package, even to this day, has excluded paid leave support for caregivers providing elder care. It's really focused on parental care. So we launched the Paid Leave Alliance for Dementia Caregivers. It's 16 organizations, Latinos for Secure Retirement, the American Geriatrics Association, Hilarity for Charity. So Seth Rogen, you might have heard of him. He has an Alzheimer's charity that's a part of this. And we all came together to raise awareness of the fact that we need paid leave support for older adults, not just for parents during the pandemic. I mean, it's essential that we support parents, but there are so many individuals providing care for both young children and for older adults, that if we're just taking care of one, we're still putting them in a really bad position in terms of being able to provide quality care and ease the economic impact of the coronavirus. So we continue to advocate for that. In fact, President Biden released his American Rescue Plan, which outlined an expansion of paid leave benefits. So that's been a big focus of ours recently. We think it's too ambiguous. It does an amazing job of expanding support for individuals in terms of direct payments, expanding unemployment insurance, really critical, all these amazing things that are going to support families. But again, it's not clear in terms of how it's going to benefit older adults, caregivers for older adults through its paid leave expansion. So that's been a focus. We released a statement yesterday signed by 10 major national organizations urging clarity from the administration on how this package will support caregivers of older adults. So we'll continue to advance for that, because our view of health equity, this is the last thing I'll say, is health equity isn't just about health services, right? Health equity is about taking a fuller perspective in terms of the solutions that we need to deploy to make health possible, to make brain health possible. It's not just about research. Research is critical. We'll continue to fight for research, but it's also about economic stability. It's about quality education. It's about supporting tailored solutions across the lifespan and spectrum. And that's what we advocate for at Us Against Alzheimer's, and excited to see all of you help to make that possible as you grow and advance in your careers and in your missions.
Jason, thank you. I'm hearing the common theme between you and Laurence that your organizations are optimistic about the new administration while still challenging them on the specifics. And I think that's what policy advocacy is all about.
Yeah, trust but verify. I think that's a critical thing to do in DC, no matter who's in the White House.
Laura, you're up next, but you also had a question that intersects the first two topics. How do you feel about asking your question first and seeing what any of our first four panelists have to say and then moving into your essay?
No, of course. So my question was, how do you guys think the new administration should handle delivering the vaccines to undocumented immigrants, especially those in essential workers and people in that risk environment?
I'm happy to take that. I know that the National Immigration Forum thinks that it's important that we vaccinate people without regard to immigration status. The virus doesn't care whether you are a US citizen, if you're a legal permanent resident, or if you're undocumented. And the virus spreads very easily from citizens to undocumented people to documented immigrants. You know, these legal distinctions right now kind of fall to the background when you're talking about fighting a virus like COVID-19. We've written a piece on the importance of getting all immigrants access to COVID-19 testing and treatments. And now that we're fortunate enough to have vaccines that are effective, we're hopeful that as the vaccine rollout occurs, that we can get everybody who is in the United States a vaccine. Now, of course, public health people are going to focus on categories of need first, whether that is healthcare providers, people in nursing homes. That's totally fine. I'm not a healthcare expert. I would defer to their expertise on who goes first. But we think it's important that people in the US get access to vaccines regardless of their status.
Thanks, Laurence. Anyone else, including our student panelists, have any input on that topic?
I mean, just as a quick follow-up, because I've been following the news on this. So, you know, our governor here in Florida, it's now requiring proof of citizenship for the COVID vaccine. And we have like other governors, like from Nebraska, saying that, you know, residents and US citizens should get priority over the vaccine, even if undocumented immigrants are essential workers, which kind of contradicts the federal mandate to give priority to essential workers. So how do you think the new administration would handle that, you know, those distinctions between federal and state governors who, you know, contradict each other?
I can briefly touch on that. I don't know if others have more to say. You know, now that we're going to have the Biden administration really focus on providing a federal response, I think the federal government is going to be able to take a larger role in vaccine distribution, and really the Trump administration had tended to defer to the states. I will say in the examples you gave, the Nebraska governor made a comment to that effect, but he actually backtracked the next day. He said, well, you know, our meat packers, I'm sure, are only hiring legal workers, so everybody there is going to get a vaccine regardless. We're not going to check for status. We're just assuming they're all legal workers. So we actually were pretty alarmed about that first, but it seems like he was just finding a way to dodge that as a political issue, which is something you'd expect to see perhaps out of politicians, but it, you know, was generally encouraging. They made clear that in Nebraska, they're not going to be checking, you know, immigration status in the door. But I think in terms of, you know, some of this disparate state response, I think having federal leadership on vaccine distribution can help. And again, you know, if the Biden administration defers to its experts, its scientists, its doctors, we think that's an important first step, because as you know, as we understand the issue, healthcare experts are going to focus on, you know, what can be done to fight the vaccine before they get into the politics of somebody's immigration status. And I've actually went ahead and posted in the chat our paper on COVID-19 testing and treatment. I encourage you all to take a look at that.
Thanks, Laurence. I'm glad you had such a relevant resource to Laura's question, and this certainly gets at the tricky nuances of all of this. Because we're following the news on Florida's new requirement. It's presented as a way to prevent vaccine tourism from other states, but it also obviously does have negative consequences on actual Floridians who might have barriers to having documentation of their residency in the state. Laura, how about we move to you introducing yourself, a little about you and what you wrote about?
Sure. So thank you so much, everyone, for being here. I am Laura Vega, and I'm currently a senior majoring in political science. I have certificates in human rights, national security, and cybersecurity. I'm also an active intelligence analysis fellow for the ICCA program at the Jack D. Gordon Institute. I'm also currently an intern for Hacking for Defense, which is a DoD initiative. And I think all of my interests are reflected in my policy suggestions because I wrote about how China's technological development will continue to enable state mass surveillance capabilities towards the Uyghur minority in China. So currently, the US-led trade efforts have disturbed the global environment and disrupted China's technological development capabilities. However, I judge that China will continue to threaten US interests abroad as its main competitor. And these companies also use US innovation through exports to modernize the Chinese military complex. To explain these policies, I noted how the Commerce Department has placed many Chinese technological companies, along with prominent technology and clothing international brands, on an entity list, which bans the exports of US technology to those organizations. To counteract US policy, China has committed $1.4 trillion for digital infrastructure, which includes AI, 5G, and the Internet of Things. China has also made diplomatic agreements that incorporate Chinese technological standards through the Belt and Road Initiative. The government also uses homegrown AI to influence other nations by gaining access to the foreign security apparatus of those countries through the Belt and Road Initiative. The implications for the Muslim minority in China are that these technology developments aid policing efforts in Xinjiang. So as technology develops, they get access to collecting serial numbers to identify people's smartphones. They get access to technology for facial scans, voice prints, blood samples, and like other personal data, essentially creating like a surveillance state in Xinjiang. Technology developments also promote forced labor because the Uyghur minority is assimilated in sectors like electronics and machinery. So they are forced to work in the sectors and helping, again, the technology development in China. For the US policy, I propose strengthening sanctions on Chinese officials. The US Congress has already made progress in passing legislation to condemn the human rights abuses against the Muslim Uyghur minority, most notably the Uyghur Human Rights Policy Act. This act has laws that impose sanctions on foreign individuals and entities responsible for human rights abuses in Xinjiang. And there are various reports on the topic. These policies also offer solutions to intellectual property theft and cyber intrusions constraints. So, remember that through the exports, they were gaining US innovation and using it in the Chinese military complex system. Well, now with the sanctions, and even more if we strengthen them, they won't be able to have, or they won't have as easy of a time getting access to US innovation to create this, surveillance technology. Yes, that is it.
Great job, Laura. And I made sure to plug the Gordon Institute ICCA program in the chat. So any students who are fascinated by what you're a part of can learn more about that. I would love to see some questions. While people are thinking about questions, I want to take a quick moment to plug the benefit of subscribing to any number of newsletters that focus on federal government happenings and policy making. Some of the newsletters that I follow that helped me see some of the articles that I read today on these very topics and have shared in the chat include Politico. Politico had a very cool article today that went through everything Biden said during his campaign that he would do on day one and which ones of them he did, which was most of them, but you can break that down in the first link there. And Punchbowl News is sort of the hottest, newest DC-based newsletter by the people who used to run Politico's daily newsletter. And I've been really enjoying reading what they put out there. I put a subscription link for that. There's a variety of others too. I also read Axios, for example, and the Brookings Brief. But for those of you fascinated by these types of topics, there are very good ways to stay abreast of what's going on. So I invite questions. Since there aren't any pending in the chat, I welcome anyone to just unmute themselves and ask them. And if you want to raise your hand, if you know how to use the hand raise feature to know that you have something pending, I welcome it. And this includes our panelists, even if a panelist other than Laura has a question for our DC experts, or even if our DC-based folks have questions for each other or their students. I'm ready for some open conversation.
Well, I don't have a question, but I have a comment. I really appreciated when Laurence gave the approach of more humanitarian or humanistic approach to welcome the immigrants into the United States, because I believe that, migration is a human right, right? So we all have the right to migrate if we are facing issues in our countries of origin. But I think, this country needs a more complex immigration reform that has two aspects. One is to handle the issues that are happening here, these undocumented immigrants, the family separations. And then the other one is help the region, right, as a leader, as the United States has been for years, and help in economic development so these people don't have to leave their homes, because maybe they don't want to leave, but they don't have other choices. For example, now, you probably read in the news last week, there was a caravan of almost 9,000 people coming from Honduras, and they were detained in Guatemala 2 days later. And they were pressured by the previous administration. They were putting pressure on Guatemala and Mexican government to stop them. But these people have been suffering a pandemic for almost a year, a lockdown. They don't have food. They had 2 hurricanes happening. All the crops have been destroyed, the cattle. So imagine that you are in a place that you don't have any ways of surviving. You need, right, to be able to go somewhere to get relief. Especially also they have a government that is corrupted, so not all the aid that the United States provided arrived to them. So there are many factors, right, that factors that drive migration. So I think this should be like a more comprehensive immigration reform in general. And of course, the pandemic is making it more pressure, because all the deportations, imagine if your family doesn't have what to eat, right? And then you are someone who was sending remittances, now is not sending the remittances anymore. And then you have to feed that person that doesn't have a job. It's very putting a lot of struggle in people. So I appreciate organizations as National Immigration Forum that are working in a more humanitarian, right, way to embrace these immigrants.
Thanks, Natalia. I'm sure Laurence was glad to hear that. Any other questions or comments? Comments welcome as well, like that one. Hearing none, I might ask Laurence and Jason, if you can close us out with each a brief optimistic reflection on how students like the 3 you've heard from today might make their way into a policy-focused career to continue acting on their passions, perhaps a little on your background and how you got to where you are.
Sure. I mean, I love that question. I think you're starting by taking advantage of opportunities that are given to you to engage with folks like Laurence and myself and Eric and with each other. So building a network, I think, is really critical to advancing in lots of careers, but especially in sort of the DC policy world. It's not as big as you think. It's getting bigger because of the virtual environment, but it's a pretty small community. So I think, building that network and getting yourself out there, it's a harder in the pandemic, but hopefully we're not going to be in this same situation come this time next year. And being able to fully take advantage of that, not fearing reaching out to people. One of the things I've experienced in my career is that people in DC, particularly people of color, like to help out. I mean, they want to bring people with them, right? I mean, that's been one of my big things that I try to do, is make sure that I'm not just walking through doors, but I'm bringing other people through those same doors with me, because they've been opened by people in my career. So that's really important. And so I think not being afraid to ask out someone for a virtual coffee, for a Zoom, to reach out on LinkedIn. I think the worst they could do is say no. And the best thing that could happen is they could be a help to you in the future with a recommendation, or just by giving you advice. So I'd say be fearless in your networking. Be mindful that people's full-time jobs are not helping you advance in your career, but be fearless in making that connection and seeking advice.
Yeah, I'd second everything Jason said. I think that's exactly on point. And a thing that he alluded to as well, which I think is right, is in some ways this pandemic gives you opportunities because you don't need to. You can work a DC internship without spending the money on moving to DC and getting housing and travel. You can do it from the comfort of your home. So if you're interested in a particular issue, this is actually a really good opportunity. And I think even after the pandemic, you're going to see more virtual opportunities. So you should definitely look into that and take advantage of them. If there's a policy area you're interested in, starting at the ground level and interning is a great way to move up. You work, spend a few months in internship, and it prepares you and gives you really important learning experience and experience on your resume. It opens a lot of doors, and that can be, starting as an intern and eventually getting hired up on staff by the organization you're interning for. We've hired some of our previous interns who have been staff for a number of years, or just positions you to work more generally in that issue space. A number of our former interns have gone on to work for other immigration groups in DC, and we've enthusiastically pushed them that way. So, if you have the time as you're in school and you can take on those opportunities, particularly now you don't have to pay to travel or move for them, definitely take the opportunity to spend a few hours a week interning somewhere, learning more about an issue, and then, preparing yourself for your career ahead, because I think internships are definitely a great way to get your foot in the door with an organization, or even in a more general issue space.
Laurence, Jason, Natalia, Anais, Laura, thank you all so much for your time today and your insights. I enjoyed this event greatly. It was a great way to end inauguration week on a note of optimism and action. I will end by saying I put in the chat, for people who like this sort of thing, my colleague Yenny from the Office of Global Learning Initiatives, who also acts as a mentor to two of our 3 student panelists, has been in here. Her office hosts a weekly Tuesday Times roundtable discussion hosted by the New York Times, and put the link to that in the chat. I wish everyone a fantastic rest of their Friday and a great weekend. Thank you all.
Thank you. Thanks all.
Thank you, everyone. Thank you for participating.
Thanks for having me.
Hey everyone, thank you.
Bye, thank you.